We've got another poster gem for you, and we're staying on the subject of neuropathy. Signe Andersen.
Yeah.
Welcome. And
Thank you.
You've got a poster. Tell us a bit more about it.
Yeah. I'm from Aarhus University in Denmark, and we did a follow-up on a cohort, the addition cohort, which is a screen-detected type 2 diabetes cohort. And I did a study on a subset of this cohort, the Danish subset, where we examined the participants for cardiovascular autonomic neuropathy. Because previously it has been shown that this condition is associated with higher mortality and higher morbidity. But also previously it has been required advanced techniques to assess for this disease, so it has not been feasible in the general care for diabetes. But now there's a handheld point-of-care device available to do examination for the subclinical state or the early stage of this disease. And you can do the examination in 10 minutes. So we did.
And what does the technology use? What's the basis behind that?
It's a handheld ECG device. And you do the recommended reflex test, some test where the people, one test they change position from lying to standing, and in another test they do deep breathing, and in the third test they do the Valsalva maneuver, and that's the gold standard for diagnosing the subclinical stage. And you measure heart rate variability, which is just the distance between the heartbeats. So from this examination, you very quickly you can get the result if a patient has cardiovascular autonomic neuropathy or not. So we did that in the 6-year follow-up of this cohort with very early detected type 2 diabetes. And they were followed subsequently in 7 years, and we followed in registers, cardiovascular disease events, and mortality.
And what did you find?
We found that the participants with CAN, or cardiovascular autonomic neuropathy, they had a double risk of mortality and also a double risk of cardiovascular disease events over this period. And also, we did analysis to see maybe or to explain the high mortality. Could it be just because they had higher risk of cardiovascular disease events? So looking at the risk of mortality in the participant who had a cardiovascular disease event during the follow-up, we saw that the mortality was much higher after a cardiovascular disease event if the participant had this cardiovascular autonomic neuropathy. So it could be explained by a more severe cardiovascular disease for these participants.
And it underlines what Ras Malik has been telling us today, that neuropathy is the Cinderella of diabetes, but it has really important and consequences which really should be averted if they possibly can be.
Yeah, that's true. That's true. But the problem has been that it's complicated to examine for these conditions, and there has not been maybe not the best consensus of which examinations to do and how to interpret the tests. But this seems to be a feasible way to do it in the general care, because this device you could put it in every. You could put it in primary care, you could put it everywhere, because it's just a handheld little device.
So I was going to ask you what next, but I know what next. You're going to take over the world with your device.
Yeah, of course.
Thank you very much indeed for coming to talk to me.
Thank you.
More from us very soon.